Good morning, Internet, and welcome to Friday, November 10th. Today I'm going to do a quick update on another article from Medscape Medical News, seen here. And the topic is semaglutide prescribing surged in the past year. And this article is written by Miriam Tucker, published the 1st of November, but it is in Medscape Medical News today. All right, so prescriptions for semaglutide jumped 150% in the past year, with 80% increase in prescriptions written per provider, new data suggests. So this comes from 350 prescribers nationwide in the Doctor First network. So 350,000 prescribers in the nationwide Doctor First network. And it's between actually just about December of last year to June of this year. So from December to June, this is where the data comes from. So the prescriptions for the weight loss formulation Wegovy rose sixfold. So this is not 6%, it rose sixfold. And Ozempic for the lower dose version, which has been approved for type 2 diabetes, that rose 65%. So Wegovy for weight loss rose sixfold, while the Ozempic rose 65%. So before December 22nd, prescribing both semaglutide drug formulations had been relatively flat. And so it's not entirely clear, and this article actually doesn't address why it didn't stay flat. They do comment that Ozempic was approved in 2017, while Wegovy was approved in 2021. So it looks to me, if I'm understanding this right, in 2021, the Wegovy was approved, and we're looking at the data from 2022. So the oral type of prescribing of oral type 2 diabetes drugs rose during this study period as well, as we saw 65%, but to a lesser degree. So it turned out that in general, family practice providers were the most frequent semaglutide provider, accounting for 30% of the total. So of this sixfold, 30% came from family practice, followed by internists at 15%, endocrinologists at 4%, OBGYNs at 2%. Pediatricians, I found this interesting. So pediatricians, typical 18 and under patient population at 1%, and specialists at writing less than 1%. The prescriptions did include cardiologists, emergency medicine physicians, hospitalists, psychiatrists, and surgeons. So a diversity of physicians are indeed writing this prescription. And so essentially what they're saying, the Dr. First Chief Medical Officer Colin Banas told Medscape Medical News that what Dr. Banas thought was interesting, that in a short period of time, primary care providers got comfortable with writing prescriptions for a drug that is relatively new, and that isn't always the case. So while Wegovy may be quote-unquote relatively new, since it is the kissing cousin or identical twin of Ozempic, except in dosing and dosing concentrations, perhaps the physicians didn't think it was really all that new. Asked to comment, Sethu Reddy, MD, the president of the AMA of Clinical Endocrinologists, noted it's to be expected when there's a weight loss agent that lowers blood sugar levels but may also result in weight loss. So that's interesting. Essentially what he's saying is, if it's not all that surprising. It's to be expected that when you have these multiple attributes of the medication, and there's enough awareness among the public that the patients themselves often ask for this. Now, I haven't I haven't checked this out because honestly, I don't get regular TV, but I am told that for a while there were a fair amount of Wegovy advertisements on TV that either have gone way down or even stopped because, well, they don't need to advertise it anymore. Lots of people know about it, and they actually can't even meet demand at present for this. And Dr. Reddy goes on to say there's clinical evidence that they not only improve diabetes control, but now they appear to have good evidence that it lowers the risk of cardiovascular events. The lack of cardiovascular data was missing from other medication. However, Dr. Sharon Lahari at Wayne State University said, we're really not sure that the prescription data doesn't actually equate to drug use. So maybe it did go up sixfold, but are the users actually going up with respect to Wegovy sixfold? We don't know. You can get the prescription, but if it's not covered or you can't afford it or something else happens, we don't really know how many people are taking it, which I found really interesting because from my perspective, wouldn't you then see that in repeat filling of a prescription? So if you write a prescription and it never gets refilled or filled the first time, can't you have a very good estimate of how many individuals are taking it? So that I found a little bit interesting and a bit perplexing. So earlier, Dr. Lahari co-authored results from a survey of 125 healthcare providers that sought to identify the factors that influence medication choices. So, I'm going to leave a link for this Medscape article as usual in the comments, and you can go and read this survey to see what you think of it. There are many barriers to entry on this, if you will, including the high cost. Well, first you have to find a physician that'll prescribe it. Then there's the high cost. Then sometimes you need pre-authorization. There's a lot of hoops to jump through. If you're not situated with a primary care physician, there may be a requirement to do blood tests and blood work, which again, if you don't have insurance or your insurance is limited, may also be a barrier to entries. And she goes on to say that many insurers don't cover Wegovy at all. So it's not even that you can jump the hoops, you just can't get it because your insurance company won't pay for it. And it's still pretty pricey. So Wegovy is a pretty pricey drug to be trying to take. Many times health insurance companies are going to want to go with less expensive and older, well-known drugs, or it may want you to go into a lifestyle management program first for a few months and so on and so forth. And then, if that wasn't enough, Wegovy coverage, it can also be time limited. So I'm going to digress a little from this article. Wegovy has such good data that it helps you reduce weight, a certain percentage of your weight, a significant percentage of your weight. In addition to that, it has cardioprotective benefits, also shown, in addition to which it appears to have other unintended benefits, perhaps have some neurological protective benefits. So when I put that together with the fact that obesity and the disease and the cost of this is so huge, and the federal government can pay for, I don't know, other immunizations out of pocket that fewer people die of than die of these lifestyle things that are correlated to obesity. My question is, why doesn't the federal government at least underwrite this to a certain extent? First, get insurance companies to not make so many hoops, and for the uninsured or underinsured, make this more available, because this would be a huge boon to the health of people and the quality of life of individuals who could benefit by weight loss. And frankly, I'm going to let you know I've been taking a semaglutide for a little over a month now, and the change in my life has been tremendous. And it just happens that I can barely afford it, barely. So that means if it goes up or other costs come into it, other things are going to go because the impact to my lifestyle has been that significant. But let me continue with the article instead. And that's just after a month. So this that we can't afford it, I think we're at a place in our nation that we can't not afford it. We pay for a lot of other things that have much less evidence that we need to have help in losing weight. And so I can tell you, as a practicing researcher, someone who has tracked weight and ketones and blood glucose and calories for a very long time, that Wegovy is not a game changer. It is a life changer. So to make this barrier to entry prohibitive, I really think that's unethical. So come on, federal government, underwrite this or somehow work with the health insurance companies to make this more affordable and accessible to everyone. All right, that's enough for today. Hope you enjoyed this, and I look forward to the next Newsy.